Good evening, Yorktown. It's Supervisor Matt Slater coming to you live from Town Hall with another COVID-19 update. Today's report, which is the first since Friday, shows 83 new cases in the town of Yorktown, giving us a total of 230. Now, we've been saying cases. I think we should start changing that. It's really 83 people, new people, infected in the town of Yorktown, and 230 people in Yorktown have an active with COVID right now. This is our 65th COVID update, and that doesn't include any of the written updates that we provided or updates during our town board meetings. And we've really tried our best to provide accurate and transparent information to the residents of Yorktown, because I believe that with that information, the residents of Yorktown would make responsible and smart decisions. We saw a steep climb leading up to Thanksgiving, and now we're beginning to see, I say beginning to see a steep climb again now that Thanksgiving holiday has passed. Earlier today, we heard from Dr. Anthony Fauci, who also cited the holidays, cited the fact that our caseloads, again, not cases, people, number of people infected who are contagious in our community, he believes will continue to grow upon itself. Thanksgiving, then our holiday season of Hanukkah and Christmas, and New Year's, and we continue to see that grow unless we make more responsible and more intelligent decisions. Again, this impacts you, it impacts your family, it impacts your neighbors. And I understand, obviously, we had Derek Anderson on, Executive Director of Northern Westchester Hospital, on Friday. He helped provide the community with an update from his hospital standpoint. And one of the things that we talked about was the fact that treatment has improved. Yes, treatment has most definitely improved. And it's an incredible tribute to the medical professionals who are tackling COVID every single day. But people are still dying. It is still killing people. Just last week in Westchester, 15 more residents of Westchester County died. And that number has unfortunately continued to grow and continues to expand. Hospitalizations are now over 300 for Westchester County. That's another metric that we've used. Again, we've talked about this as well last week. Number of infected people in the community doesn't really show community spread. Infection rate obviously shows community spread. That data, and I've been begging, genuinely begging for it, has not been provided. But now, as we heard from the governor in the last week or so, the shift of focus, again, has been moved, and that's over to hospitalizations. Westchester County hospitalizations, as we heard from the county executive as of Sunday, is now over 300. Now, it doesn't come close to our max hospital capacity, but it's continued to grow. In fact, I believe he stated in fact, we've grown just by another 50 people since last week. And in total, Westchester's infections, meaning, again, not active cases, but people who are infected with COVID, that number has doubled in 3 weeks. 3 weeks. As of today, the county executive reports 7,830 people actively infected with COVID in Westchester County. Last week, that number was at 5,764, and 2 weeks before that, 4,662. Again, we're seeing that steep climb, and we have to make responsible, intelligent decisions. These numbers countywide equate to the end of April, and we all remember those days. I remember those days like they were yesterday. They were very dark days. And here we are again seeing those numbers reappear. And I think it's important to note again, listening to the science and listening to the medical professionals. I know what I know. I know what I don't know. I rely on medical professionals and scientists on these types of matters. And if you listen to folks like Dr. Fauci, again, the concern is if we don't make more intelligent, more responsible decisions, as you can see now, our caseload will continue to grow and grow quickly. Again, with Hanukkah, Christmas, and New Year's coming, we really have to make better decisions as a community. The number, again, 83 newly infected individuals in the town of Yorktown and 230 active individuals, meaning, according to CDC guidelines and the Department of Health, they are within that 2-week window, meaning they are most likely contagious. I stated earlier that Governor Cuomo is now emphasizing his focus on hospitalizations, and I've heard it. I've gotten phone calls and emails about again reinstituting a pause. I want to remind everybody that the town of Yorktown remains in a state of emergency. That does not impact our schools. It does not impact our businesses. It does not impact our houses of worship. Frankly, the governor, early on in this process, had issued specific orders to make sure that there was one singular decision maker in this entire process, and that is he, the governor of the state of New York. It's not the county executive, it's not the supervisor, it's not the town board of the town of Yorktown. This is all being driven from the governor's office. And so the governor today announced that any potential pause which would be instituted is going to be dictated by hospitalizations. And if you look at the hospitalization rate for Mid-Hudson, again, that's the that's the region that we are in. Currently, the Mid-Hudson, as of yesterday, had 618 people in the hospital. Again, Westchester making up nearly half of that, and 81 in the ICU. And if you track back, this is all available on the forward.ny.gov dashboard. If you track back, it shows you the curve from the spring back down to those dog days of summer when things got back to relative normalcy, and then you see the curve back up to where we are. The last time we saw numbers like this, May 21st, we had 617 individuals hospitalized in the Mid-Hudson region. Which Westchester is a part of. And so again, I ask the residents of Yorktown. I know that we've been through a lot, but we also heard from Derek Anderson. We had a very extensive conversation about the vaccines. This is a big week for the vaccine process. And so we still have a long tunnel to go through, but you can see a speck of light. And so we have to keep our focus on that. We have to keep our focus on what we know works. Wearing a mask works. Washing your hands work. Social distance works. That's one of the reasons here in the town of Yorktown we've modified our work setting. We've actually modified our work setting so that we have more people working from home, again, to pull people apart, to make sure that we are properly social distancing and limiting exposures, as well as with our labor force. And I also want to make a point to say that the entire town of Yorktown and the entire workforce has continued to perform their duties, both through the first wave and through this wave. And they've continued to uphold their commitment to the residents of Yorktown. But again, it comes down to social responsibility. It comes down to making those responsible and intelligent decisions, especially now as we get closer to the holidays. I know that we are all very social beings. I love a Christmas party or a holiday party just like the next person. But this is a year where we really need to reconsider, and we really need to think about ourselves, but think about our neighbors, think about our families. You know, here in Yorktown, I'm raising my 2 kids, but I also have my mother and my grandmother living in Yorktown. And I need to make smart choices that don't just impact my kids, and my son Charlie attends our local elementary schools, but we need to make choices and understand the choices that we're making that could possibly impact our seniors, like my grandmother. And so again, I say to my fellow residents who, again, I want to applaud for the diligence that you have already shown. But it's always darkest before the dawn. And we can see that speck of light down that long tunnel. It's coming. But now is not the time to let up. So please stay focused, stay smart, make the right decisions, be a good neighbor, be a compassionate neighbor, be an understanding neighbor, and we will get through this last piece of this dark, long tunnel. Again, I'm going to continue to provide this information as it becomes verified to make sure that you have all the information you need to make those smart choices to get through the next, hopefully, month to 6 weeks until we get to that light at the end of that long tunnel. Until then, stay safe, stay healthy, and we'll talk to you soon. Thank you, Yorktown.